Good morning and welcome to the Faculty Staff Town Hall sponsored by Penn State Today. Today we'll be discussing the university's response to the novel coronavirus. We're going to be doing things a little bit differently today as we're implementing social distancing in our town halls. We are hosting our first online-only town hall, streamed here at liveevents.psu.edu. You can email your questions to questions@psu.edu or submit them through the Google form linked on this website. We have already received hundreds of questions at this point, and we expect to get more questions today. We will answer as many of them as we can, and we will respond after today's sessions if there are questions that don't get answered. Today we have with us University President Dr. Eric Barron, Executive Vice President and Provost Nick Jones, Senior Vice President for Finance and Business David Gray, Vice President for Human Resources Lorraine Goff, and Associate Professor of Biology and Researcher with the Center for Infectious Disease Dynamics at Penn State, Mathieu Ferrari. First, President Dr. Eric Barron.
Thank you, and thank you for joining us in these very stressful times. I want you to know that the decisions that the university is making are based on three objectives. The first and foremost objective is the health and safety of our faculty, staff, and students. The second is to get our students to the finish line so that they can graduate, continue their education with the learning outcomes that we know are so important to their success. And the third is founded on a concern for the financial health and well-being of our employees and for our communities. To address those objectives, President Jones is leading Provost Jones, I just promoted him. Provost Jones is leading a task force that has a significant number of committees that are dealing with our response to the pandemic as issues arise. And I am leading a strategic group that is looking at some of the downstream implications for the university, as well as an executive team that has decision-making authority. I'm also working hard to make sure that our Board of Trustees are well-informed, understand our actions in weekly meetings so that we can proceed with those decisions. In that regard, I would like to announce one decision today. Penn State University has made a commitment to pay the salaries and benefits of all our employees at least through the month of April, even in the face of mounting financial losses associated with parts of our university that are not currently operational. Our objective here is, with all this stress, not for you not to have an abrupt financial dislocation when you're dealing with so many other different things. By deferring any decision until the end of April, that gives us a chance to be strategic, to think carefully through how the pandemic is evolving and what we can do best to mitigate the impacts on the university, our employees, and our communities. You know, these are unprecedented times, and I just want you to know how much we appreciate all the work of our faculty and staff to deal with these issues as they emerge, especially when you realize the guidance we get from all sorts of different directions can even change on a daily basis. You have our gratitude. Thank you so much for what you do.
And thank you, Dr. Barron. To give some context to this novel coronavirus, Dr. Mathieu Ferrari would like to say a few words. Matt? Again, Dr. Mathieu Ferrari is an epidemiologist here at Penn State. He is a researcher with the Center for Infectious Disease Dynamics and an associate professor of biology. We'll hear from him in just, there he is.
Yep. Hi. Thank you. So my role has been to bring some real-time public health perspective to the university's decision-making processes. And I think from a public health perspective, Penn State is really doing many of the right things. We've moved to remote learning, moved most of our staff to telecommuting, and we've canceled large and even small events. But importantly, the university is working hard to provide staff, students, and faculty with the information, resources, and infrastructure to comply with these distancing guidelines. Importantly, this virus might be with us for quite a while. And right now, social distancing and testing and hygiene, these are the best tools that we have at present to keep this thing at bay. And as a community, we're buying ourselves time to strengthen the health systems, the infrastructure that are keeping us healthy now, and to develop the new systems and therapies that are going to help keep us healthy in the future.
Thank you, Matt, for that important context. Again, thank you for that important context. Provost Jones, you would like to outline some of the steps that the university has taken up till now to slow the spread.
Thanks, Ben. I'd like to begin just by echoing President Barron's priorities and make a few additional comments about them. First and foremost, the health and well-being of all of our employees and students is our top priority, and that has really been paramount to all and underscoring all of our decision making. I do want to thank the tireless efforts of so many in our community, our employees, many of whom are working and teaching remotely or supporting that enterprise, and are really doing yeoman service in keeping the university operating despite these extraordinary circumstances we face. We know that everyone's lives have been completely upended by this outbreak, and I want to recognize how well our faculty and staff across the institution have risen to the challenge. As President Barron indicated, we also are fulfilling our mission of education and ensuring that we are continuing to provide instructional opportunities for our students. And we thank everyone for answering the call and helping us flip that switch just a week ago to move to a remote learning enterprise. For context, on Monday morning last week at 10 o'clock, we had about 63,000 participants in around 350 Zoom sessions. That's truly a remarkable achievement, and the numbers belie the amount of effort that went in behind the scenes to make that happen. We had really very few problems. It's pretty remarkable. As the President indicated, he asked me to charge and coordinate the work of a series of task groups to address all aspects of the university's response and make recommendations to the executive group where appropriate. You can see this list of task groups on your screen. I won't read them. They are working daily, and I would add nightly as well in many instances. As we enter our second week of remote learning, if you're still adjusting to taking online courses, please visit our website, remotelearning.psu.edu. Still recognize this is a major adjustment for everyone. Finally, I know you're wondering about the employment situation at Penn State. President Barron addressed some of this. While it is too early to be specific, there is no question that we are going to be impacted. No enterprise across the nation or across the world is immune to the deep recession we are now facing. At this moment, we are asking units not to fill new positions or open positions unless they are mission critical. While we maintain critical reserves, it is reasonable to assume that we will not have a GSI program this year, which I know will be a big disappointment to many. That will not be the subject of today's session. It is too early. We are managing, but we feel it's important to acknowledge some of these challenges. We promise and commit to continue to communicate through this and by other means. Together, we will see Penn State through this crisis and eventually emerge an even stronger university and community.
Thank you, Provost Jones. And he mentioned a number of websites and different groups, and I just want to remind you that all of that information is on the virus site that the university has created that is linked on the site you're streaming at, liveevents.psu.edu. So if you missed any of those websites, you can go back and refer to that. Thank you all again. I would like to remind you that you can continue to submit questions via questions@psu.edu or the Google form on this website. But again, we've received hundreds in the last few days, and we'll get to as many of them as possible. Now, Dr. Barron, we're going to start with you, and you addressed this in your opening statement, but I think it bears repeating because many people are very concerned with this. As this new situation develops, will faculty, staff, and those student workers continue to be paid?
Yes, and the answer, as I said, is yes, they will through the end of the month of April. And mid-April, we will start to look at what our capabilities are. But as I said, we do not want an abrupt financial transition for our faculty, staff, and students.
Thank you. Lorraine Goff, many staff members have contacted us and said that they're doing jobs that just can't be done remotely, but have no other options for childcare with schools and daycares closing. What can you do for these people? Lorraine Goff is the Vice President for Human Resources. And
Ben, thank you for that question. It's a very important question. We have heard it as well. We've encouraged leaders to be as flexible as possible and as creative as possible in looking at opportunities for telecommuting. So, for example, there may be work that lends itself to telecommuting that simply hasn't been done in the unit, projects, for example. And so we ask all employees to work with their unit leadership and maybe even their HRSP to think creatively about the kinds of work that they can take on during this time of change and transition for the organization.
Thank you. And I'd like to thank everyone for bearing with us. Obviously, in keeping with social distancing, many of our group is joining remotely, and with that comes some adjustments. I'm sure you've all been dealing with this as you have Zoom class meetings and Zoom meetings with the rest of your staff members. So we appreciate your patience, as sometimes it takes an extra second or two for people to respond. We do have a question now for David Gray. What can the university do financially or otherwise to support family members who are going through really tough times right now?
Yeah, thank you, Ben. I think clearly the most significant thing the university can do to help support our faculty and staff through this difficult time is what Dr. Barron outlined at the outset, which is removing any doubt about the continuation of salary and benefits for all of our employees through the end of the month of April. And that, I think, it is a significant commitment on the part of the university. We'll be, as he suggested, considering the extension of that or what we need to do further in mid-April. Also, for any of our employees who are feeling particular stress financially, there is an employee assistance fund which is managed by Vice President Goff and her HR team, and folks can certainly make appeals to that group, to the HR office, for consideration for any particular needs that they might have that go above and beyond normal. So those are just a couple of things, Ben, that come to mind.
Thank you very much. Now, Dr. Barron, we'll go to you again. With the decision to extend remote learning through the end of the semester, do you want staff and faculty to work from home in that same time period?
So this makes a great deal of sense. What's important here is social distancing, to do everything you possibly can to work remotely as we're delivering that education. So this should be everybody's objective.
Thank you. Provost Jones, I know there has been some communication about this already, but I think it's important to use this venue to allay some people's fears. How is this going to affect delays in research and how that affects tenure-track faculty?
Thanks, Ben. Yes, we acknowledge that this emerged very early as a concern among our faculty because, frankly, our promotion process is a rigorous one and our expectations are high. To perhaps address some of the concerns that we knew were out there, enabling faculty, we hope, to focus on what is really important at this time. We made a decision to extend the tenure clock for anyone who is in the probationary pre-tenure period by 1 year. What that means is no one will have to request an exception to have the clock extended. Any faculty among us who decide to go up on the regular time scale, that will not be considered an early promotion. So we're hoping that this 1 year across the board extension will relieve a lot of the concern that faculty may have due to interruption of their research.
Thank you. David Gray, we have another question for you. Some faculty members and some staff members are having to still work on campus during this time. What are you doing to support them and to encourage best practices and social distancing and hygiene amongst that personnel?
Yeah, so we have really sent out a powerful and I think clear message through our unit leaders and through all of our managers and supervisors for those staff and faculty that really find it absolutely essential to the functioning of their jobs, that they need to come to campus to maintain very strong social distancing practices. The physical distancing of at least 6 feet between individuals is something that the epidemiologists have told us is absolutely crucial to avoid the spread of this virus from one person to another. And we're doing everything we know how to do to reinforce through our communications and our leadership structures to reinforce that message about the importance of I prefer to call it physical distancing. We want to maintain our social connections, but we do need to maintain that physical distance, a minimum of 6 feet. And we are doing everything we can to amplify the need for folks to practice that if they find it necessary for their job functions to come to campus.
Thank you for that. We've had many people address us with concerns regarding their prescriptions. Lorraine Goff, we have a question that would be best directed to you. Many people are concerned, is the university pharmacy going to be open during this time?
Yes, it is. The pharmacy is open now and will continue to be open, including curbside delivery, to ensure that we can meet the needs of our faculty staff and their family members in regards to prescriptions.
And if there is a change to that as we go forward, these are in uncertain times, and if the university does have to close that particular service, what can be done to help these people who have been depending on that?
So we find ourselves in a position where it needs to close. Prescriptions can be transferred to CVS Pharmacy, so employees can call the pharmacy directly to initiate a transfer of their prescription. And there is information available on the HR website with contact information for the CVS Pharmacy.
Thank you. And again, I'd like to remind everyone that we'll post links to that HR website along with all of the other websites we're mentioning today on the liveevents.psu website. We have had several questions coming in about the science regarding the novel coronavirus, and that's why we felt it was important today to bring in one of our epidemiologists who's studying this. Mathieu Ferrari, can you explain why 2 weeks is enough to quarantine someone who may or may not be showing symptoms, but yet they still could be infected?
Yeah, so this is a great question. So 2 weeks is a good period and a safe period of time on average, right? So studies have shown that individuals can shed virus for up to 2 weeks after infection. And we're increasingly finding that that's true not only for individuals that are severely ill and showing symptoms, but even for individuals that are asymptomatically infected. And in fact, many children, thankfully, aren't having severe symptoms, but it is possible that they're still shedding virus into the environment, right? But it's important to note that some people will progress faster through this and other people are gonna remain infectious for longer. So it's really important to consult with your healthcare provider about what the conditions are and what the guidance should be for breaking quarantine at the end of that 2 week period.
Thank you, and we'll stick with you for just a minute, but we've heard a lot about social distancing, and can you explain to our audience why that is such an effective tool?
Sure. So the first thing to note is that this virus is transmitted through respiratory droplets, so through coughing, sneezing, and even excited talking, right? Being close to each other, talking and enjoying each other's company, unfortunately, puts us all at risk in the physical space, right? And as well, those droplets can get on surfaces, and then we can touch those shared surfaces, bring the virus to our mouths or nose or eyes, right? So again, good hand hygiene, et cetera, is critical for breaking that transmission cycle, right? So the best thing that we can do is to stay away from others physically as much as possible. And that might mean staying home, telecommuting, right? Keeping kids out of school, et cetera. But I do want to stress the point that was made earlier that physical distancing shouldn't necessarily mean complete social distancing from each other. We actually really want to maintain those social connections that are what bring us together as a community and keep us successful as an organization, right? So I think everybody should consider things like getting takeout delivery from the businesses and restaurants that we most consider the small businesses that are going to be most heavily impacted by the economic consequences of this. And if I can make a specific note out to my colleagues among the faculty, now is a really good time to consider the importance that the staff play in our lives and to ensure that we continue to reach out to them, both as part of our business operations, but also as part of our network and our community of friends and colleagues here at the university. So I think that we really need to keep in mind those that are most impacted by this and make sure that we maintain good social connections so that we can all work together to try and achieve this broader community goal.
Thank you very much. I think that's an excellent point to remind people of. Dr. Barron, we have a question for you that came in, and how do you make the determination on what services or employees are essential during this time, and is there any guidance to supervisors from the university at large?
Yeah, there's actually quite a lot of guidance. We can begin with even the governor's communications on what are essential services and what are not. So the provision of healthcare related functions, food and housing related to our students as the educational enterprise, ensuring that we have remote education continuing because of the potential penalties that our students pay. So there is a characterization by the governor's office on those areas that are essential. And we know from ourselves and that things like the care and feeding of animals with an agricultural school or with animal subjects as part of the research enterprise, how important it is that we keep those functions going. So there are very clear guidance on what is essential and what is not essential, and we're working hard to make sure that that guidance is clear.
Thank you. And Nick Jones, I'd like to follow up with you, sort of dovetailing off that question. How do we keep the essential research going on here at the university? We are, known for our research here at Penn State, and we need to keep that going. What can we do to make sure that happens?
As our Senior Vice President for Research, Laura Weiss, sent out a fairly detailed communication last week across the university, providing guidance on exactly this issue. And it is very important. There is some research that obviously can be conducted by people working at home and telecommuting, but there are other essential research functions that really can only be done in the laboratory. So Laura and her team put together this guidance, ran it through the deans to ensure that everybody was on board, and now that has been broadly circulated. And the bottom line is we do support, as the president indicated, some of our key research functions that simply must continue through this. The faculty, staff, and students who support that enterprise it is our expectation, as David indicated, that they maintain appropriate social distancing or physical distancing expectations. But we recognize that it is very important, not just to Penn State, but actually at a time like this to the nation, for some of this research to continue. So that is permitted according to Senior VP Weiss's guidelines.
I mean, obviously coming to mind would be the research of some of the things that Dr. Matt Ferrari is doing that is actually helping to track this virus and see how it emerges. What Is there a recommendations, maybe one person in a lab at a time? Would that help something like this?
I think the general guidance about physical separation, in some laboratories, I think one person in the lab at a time would be a perfectly appropriate piece of guidance to provide. At some level, it is our expectation that our faculty, staff, and the graduate students who are involved in these efforts have become very aware of what social distancing means, and we're really depending on their best judgment to adapt to these different situations.
Thank you. And we have a question for David Gray now. And there's a lot of on-campus buildings. What is the access looking like to that during this time? Many people would like to know, can they come into their office? Can they come into the various buildings on campus as they would in a normal situation?
So, Ben, it's not quite a normal situation. The buildings are typically in what we call weekend mode of access, meaning that the locks, the exterior doors are locked in general. And for those buildings that have swipe card access, those employees, faculty or staff that have critical functional requirements to be, to have physical presence in the building will be able to swipe themselves in, or they will have a physical key to that building where they do their work, and they will be able to gain access through that mechanism. But all of our buildings are pretty well locked at this point in time, with only people needing to have access, be they faculty or staff, to get into those facilities where their offices or their laboratories are located through either a swipe card or a physical key.
Thank you. And Lorraine Goff, we have a question for you now. And how will remote work and the telecommuting impact annual staff reviews?
So we understand that the way we work and where we work has changed significantly over the last couple of weeks. So we are looking at the timing of performance evaluations. And we're looking at moving that timeline out a little bit to make sure that we give people time to think about how we will conduct these in the future. So we will make a change in terms of timing, and I anticipate to be able to provide some information and more detail about that very, very soon.
So I would encourage you all to continue reading Penn State Today. Even though people are working from home, that daily email is still going out as it normally would. We will also post our latest information regarding to the novel coronavirus on that virus site that is linked on this website, liveevents.psu.edu. That resource is really the best place to find out all university news and all university steps that we are taking to combat this virus. Please bookmark it, visit it often. That is where you will find your most up-to-date information. Dr. Barron, we'd like to do a follow-up with you. You spoke in the opening about how you wanted to manage these fiscal challenges, and you put a plan in place. It sounds like you're being very thoughtful as you're going about this. Can you tell us a little bit more about that?
Sure. We are trying to be very thoughtful. So first of all, the length of time at which the pandemic is having a significant impact makes a big difference on the financial position of the university. We're looking collectively at the ways in which we can save resources and be strategic about our thinking. And it's so fast changing in many ways that to sit there and make a decision right now doesn't seem appropriate. So we want to watch this carefully. We want to look strategically at all of the different parameters that are affecting the mission of the university and the financial health of the university, so that in looking at that carefully, we can also take into consideration the stress that our employees will feel and the stress that our communities will feel.
Thank you. We have some more science questions coming in. And so Matt Ferrari, we have been asked, now that some sources are saying they're not going to test people if they're only showing mild symptoms, could you explain the thought process behind that? Are they attempting to save these resources should things get worse? And is there a start and stop time frame to where we would be rolling these things out?
Yeah, so testing is really one of the critical resources we have for combating this outbreak. Again, both the social and behavioral interventions that we're putting in place, such as distancing, and then testing to be able to know how much the outbreak is spreading, where it is, and how fast it's moving, so we can allocate resources appropriately. Unfortunately, everybody in the world is trying to catch up to this outbreak, and so testing capacity is trying to catch up as well. The number of tests available and the number of labs that can carry that out, right? So we hope that is going to be getting better over time, and we have good indications that that is improving over time around the United States. I think importantly, the thing to consider for yourself and for individuals is if you start to feel ill, contact your health provider, again, ideally by phone or internet, to find out what testing resources are available and whether or not you will be eligible and prioritized for testing if there are limited resources. That way, if your symptoms are not severe, you can keep yourself isolated and you don't need to put anybody else at risk by going out. And only consider going out if your symptoms begin to worsen, again, in continual consultation with your healthcare provider.
And if I could build on that, you've mentioned some about giving people more time, giving the health system more time. Can you explain flatten the curve? I know you've spoken about this and why it's important we're taking these steps now that we can give time for those resources to build up and hopefully have a better chance.
Yeah, it's fantastic. So really, again, this is a brand new virus and it's a brand new disease. So not only is it new to us, it's new to our doctors and it's new to our health systems. And so not only are the doctors and nurses learning what the symptoms are and the clinical standard of care, but also health systems weren't able to prepare for this in advance. They didn't necessarily know to increase staffing ahead of time and increase procurement of medicines and masks, et cetera. All of that is being done reactively, right? So the best thing we can do in the absence of drugs and viruses is to use the tools we have at hand, which are behavioral interventions, to try and slow the spread of this outbreak and keep it from getting above the capacity needs of our health system. And what that's going to do is allow our health providers to fill in that gap and prepare for when the number of cases of ill people is going to increase. What we're then doing is buying time for them to learn new procedures, figure out which kinds of off-label drugs might be effective in treating this, right? Then we're going to have a new phase where we can then start to use those technologies and those procedures. That's going to buy us some time for developing the research to come up with new drugs that are specifically tailored at this virus. And that's going to buy us additional time for the long-term goal of developing a vaccine that can actually prevent healthy people from ever getting sick with this thing in the first place.
Thank you. That's very helpful information. Provost Jones, we have another question for you. There were a number of recommendations recently in the Faculty Senate. Many of them we will address later in the next session. But one of the most important points that people are asking us now is perhaps a change to SRTEs. Are you still considering that, and what is your thinking behind it?
Thanks, Ben. Yes, and actually, before I answer that question, if I can just reinforce something you said a few moments ago and put in a plug for the Penn State Go app. If you have not downloaded this onto your mobile device yet, I encourage you to do so. And a one thumb push will take you to many of the resources that Ben had shared. So just a little bit of marketing for the Penn State Go app. The SRTEs are an important part of our academic process for providing feedback to faculty and their academic leadership about how things are going in the classroom. What that means in the spring 2020 semester, of course, has been completely upended. And so we wanted to be thoughtful about what our traditional SRTEs mean in that context. So after some consultation and certainly being respectful of the resolution that we received from the University Faculty Senate, we decided, consistent with that resolution, that we would not use SRTE scores in this semester for evaluative purposes. They would go to the faculty members only so that they can see the comments and get the feedback themselves, but they won't be routinely distributed to the faculty members, department head or dean. Of course, if the faculty member would like to share SRTEs, that is her or his prerogative to do so, but that won't be routinely done. Again, this is an attempt, I think, for us to just recognize the highly unusual circumstances that we're all facing as we flip from in class to remote instruction modality in the middle of a semester with basically 1 week's notice.
And if I could build on that with you for just a moment, we are asking a lot of our faculty members, and we appreciate everything that they're doing because this is a very trying time for our faculty members and our students, obviously, who are teaching and learning in an environment that they're not used to. What kind of advice are you giving or have you given to faculty members who are finding themselves in this sort of brave new world with online instruction, remote learning?
Well, we are tapping into the innovation and creativity of our faculty. And I have to share with you, and I know President Barron has seen some of these stories as well, just extraordinary examples of people doing things that we could not have even imagined or suggested a week ago. So we're imploring our faculty to lean in there, be creative, be innovative, do new things, and know that we are there to support you. We have our website up, remotelearning.psu.edu, which is a tremendous resource. But as always, if there are any concerns or you're experiencing any challenges, please contact us as soon as possible, and we will make sure that we will get somebody to help you.
Dr. Barron, I think you wanted to add something?
I just want to echo that comment that Provost Jones has made. The number of times where you start with this notion that how could we deliver that part of an education remotely, that's going to be a challenge. Where I've heard faculty or program heads say, well, you know, we have to be creative. We've got some ideas and our students are game. Or you have a case where a faculty member is trying to decide how to deliver an experiment, and then you discover science faculty joining together to share resources and design of things that can be effectively done remotely. I know there's a lot of issues. There always will be bumps in the road in a case, especially such an abrupt transition, but it's really heartening the number of faculty that are entirely motivated by, I'm going to deliver these learning outcomes for our students. And being creative, thoughtful, and in addition to that, doing an awful lot of hard work to get there. It's really appreciated. Mm-hmm.
You know, those are some great sentiments, Dr. Barron. I was wondering if there was a way that we could encourage people who have those good stories to share them with our office. I'm sure in these trying times, a lot of people would benefit from hearing not only those nice stories that make you feel good about being a Penn Stater, but also some helpful suggestions to others who said, you know what, that's a great idea. I'm going to implement that in my remote learning class.
So our already produced is a kind of blog on these stories. And it can become an opportunity for people to write in and give suggestions and hopefully unite people. I suspect there are many ways that we can work to unite people when you consider the academic leadership, but we're hoping to really be able to take a certain amount of solace in what people are doing, how they're doing it, and make sure other people can join in that creative, thoughtful exercise.
I'd just add also, I think I meant we actually have two websites to support this enterprise. I think I mentioned remotelearning.psu.edu. I do want to emphasize there is a second website, remoteteaching.psu.edu, which is really focused on supporting the needs of our faculty. Both are useful, but for our faculty, that one is probably the one that is more relevant. And to the President's point, we're more than happy to share success stories there as best we can.
That's great. And we had a follow-up question. You know, what can faculty members do to help out with that and maybe to help implement lab and research from afar or at home?
There are a number of ideas that are out there, and I know that some of these ideas are being shared organically. We're seeing tremendous collaboration across the entire university. Folks at University Park sharing ideas with their counterparts at campuses, one campus sharing an idea with another. And to the President's point, there are just tremendous implementations occurring all over the Commonwealth pretty much as we speak, as people get their hands around this issue. For example, faculty members doing demonstrations from their kitchen table that they live stream and then follow up with data that go to students. We realize this is challenging, but we're trying to also look out beyond Penn State and pull in ideas that we're seeing and hearing at other institutions and make those available to our faculty as well.
And if we can address Matt Ferrari again, we have a question coming in, and in the face of such a daunting situation that we're all looking at, a global pandemic by definition, what can the average Penn Stater do to help flatten the curve? You gave us some helpful hints earlier, but I think it does bear repeating.
Yeah, exactly. So really, there's two things we can do. We can be good as individuals, and we can be good as community members. At the moment, the best thing that we have available for us is our behavioral interactions. So that is physical distancing and hygiene. That's what everybody can do as an individual to protect themselves and to protect others. One really important thing to keep in mind is that it is possible to be infectious before you start to experience symptoms. And many people will have a mild course of infection anyway. So what that means is that we should all be thinking about our interactions as though we're already infected and prevent ourselves from bringing others to harm by going out into the community too much, right? Now, that's what we can do as individuals. I think we also have a responsibility to each other as a community to try and help and facilitate everyone continuing those best practices, right? And that means, again, calling up friends, texting your neighbors, checking up on people to make sure that everybody has the things that they need and that nobody is left behind, right? That also might mean considering things like supporting small businesses in town. We have a big responsibility to the community around us, getting takeout orders delivered to us from our favorite restaurants or buying a gift card from our favorite store that we might be able to then use later on when this whole thing is behind us, right? So I think that we really need to think about our contribution to each other as a community for the moment, and then hopefully we'll use that time to build up the medical systems and the therapeutics that are going to allow us to return back to normalcy.
And if I could follow up with you, we had another question. People are curious specifically about what kind of research is being done here at Penn State to combat this novel coronavirus, either looking at its origins, looking at treatment, looking to the future. Can you tell us some of the things that Penn State's doing in this realm?
Yeah, that's fantastic. So really, research is one of the engines of this institution, both in terms of generating new knowledge and helping to keep our community engaged and employed. So it's really important that we maintain that and we pivot much of our research enterprise to the things that are most essential right now and at the moment, right? And so to that end, we're really trying to focus on specific operational research that's going to be most helpful right now. So that's folks that are looking at things like developing new therapies, so new drugs and vaccines, testing out new molecules. So those things are going on. Lots of other people are working on how to develop and rapidly produce and rapidly scale up existing testing technology that will allow us to be able to test everybody as soon as we need to and shorten the amount of time that infectious individuals might have to be out there in the community, right? There are others that are actually that are using this opportunity to figure out how we can most effectively come together as a community, studying things like how do we best communicate information, right? And how do we best interact with government officials and institutions across all levels. So really that scale of research is ranging from sort of the very molecular scale all the way up to population and social interactions. And that's really capitalizing on the interdisciplinary strength that we have at Penn State. So we're building on our community to try and help our community. And I think there's some really exciting initiatives, and I hope that everyone will be able to hear about those in the coming days and weeks so that everybody understands what we're all a part of trying to do to contribute to the end of this pandemic.
Thank you. That was wonderful. Lorraine Goff, we're going to have a question for you. Many people have reached out to us and said, you know, between just hearing the news about this novel coronavirus and being stressed at a new environment in teaching and working from home and, you know, doing their staff responsibilities in an environment where they might now have children lying around, is there anything mental health-wise that can be done for our families at home?
So Penn State has an employee assistance program. It's available to all faculty and staff, all employees. And we'd encourage you to reach out to the EAP if you think you need assistance. They're available 24 hours a day. They can do in-person sessions, of course, given social distancing. There are also options available through telephone or other online options. But again, they are a valuable resource. It's a prepaid benefit paid for by Penn State and available to the members of our community, faculty and staff, but also their family members. Again, there's information on the HR website, contact information, and we really encourage you to reach out to them. Of course, your own personal healthcare provider can also be a resource, but many of them are overwhelmed with other challenges right now, but the EAP is certainly available to you anytime you might need them.
Thank you very much. Nick Jones, we have a question for you. You mentioned how hiring should maybe be put on hold as we're, you know, as long as it's non-essential. Can you give us a little bit more information on that? What if there's a unit, as hiring is done constantly here at the university, what if they've made an offer and, you know, should they rescind that offer? How should this be handled at this time?
Thanks, Ben. We're not at the point, nor do we think it's a desirable practice to rescind offers that have already been extended. So we are planning to honour those. What we're asking our budget executives to do across the institution on the faculty side is to slow up or pause searches and hold on extending any new offers, except in really compelling circumstances. And there are those compelling circumstances. Those will just need to be approved on the academic side, certainly for faculty and any staff appointments by me, and on the non-academic side by David Gray. This applies also to unfilled staff positions, and we know that there are many of those across the institution at any moment in time. So we're asking that for the time being, those not be filled, that those processes be paused. Again, there are some critical appointments that must be made, and so those, again, requests for exceptions for those appointments should come up through the budget executives to either me on the academic side or David Gray on the non-academic side.
Dr. Barron?
Yeah, I would just like to add to that about even the challenges of hiring, recruiting, interviewing someone in a world of social distancing. And many, many times you really want to be with the person and to have those discussions and to have that sense of how that individual will fit with Penn State. So there's lots of reasons to be thinking in this way, including the fact of preserving resources while maintaining critical positions. But I'll just give you an example. David Gray had announced his retirement effective at the end of August for the position of Senior Vice President for Finance and Business. That would be very challenging to do that recruiting. He has graciously agreed yesterday to continue in that position until the end of December. It not only gives us an opportunity to have a steady hand that knows Penn State, to be able to move us through the financial issues that we're facing, but it also gives us the time so that we can do that recruiting for a very important position in the best way possible to have the best outcome possible.
Thank you very much. And thank you, David Gray, for sticking with us a little bit longer. And since now we know you're going to be here, we're going to direct this next question to you. We have had several questions from staff members that came in and asking, are they going to be reimbursed for things like gym memberships and parking permits that they have paid for and are not using at the moment?
These are great questions, and I understand particularly the strains that everybody's feeling right now. Why those questions would arise. The only thing I would ask is a little bit of patience for our faculty and staff colleagues as we work through some of these issues. We've been most attentive in these first couple of weeks of pandemic response to maintaining important continuity of operations across a broad swath of areas. And some of these issues, like those you just raised about refunds for fitness club memberships and the like, parking fees, are things that we have not yet gotten to, but we will. So I would just ask for a little bit of patience and forbearance. It's not that we've forgotten about those, and we understand that there are elements of fairness that we need to be fully considerate of, and we will. So it's simply to ask our colleagues to give us a little bit of time and patience as we work through those, and we will be responding to those requests. And we'll obviously working through Penn State today and strategic communications, we'll make sure we get that information out as soon as those decisions have been reached.
Thank you. Nick Jones, we're going to have a question for you. We've had several faculty members want to know more about, do they need to continue to teach their classes at the same time that they've always done? Is there an importance to this, or can they sort of adjust?
Yes, this is the difference between what we call synchronous or non-synchronous or asynchronous learning. And we made the decision when we switched from in-class instruction to remote instruction to do it in the synchronous mode, keeping classes offered at the same time slots that they were previously offered, and maintaining that structure across the institution. We didn't make that decision lightly, because we knew that it would be impactful and challenging for many of our faculty. There were a number of factors that led to that decision. Interestingly, one of the considerations was what Matt referred to earlier, the importance of maintaining community and social connections, even though they had to be transitioned in many cases to virtual environments. Interestingly, what we have learned over the past couple of weeks actually is just how important that is. Our Vice Provost for Online Education, Renata Engel, participated in a webinar offered by the University of Hong Kong that described their experience and just how much better it was for students who were used to classroom instruction to learn in that synchronous environment. So we've seen that emerge very quickly here as all of these communities have emerged around those teaching environments that are actually quite interesting and in many cases stronger than the environments that existed within the traditional classroom. So as we move forward, we're certainly looking for flexibility in this to accommodate the needs of both our faculty and our students, many of whom now are in different time zones. But we think there's a lot of importance associated with staying in that synchronous mode with some flexibility as long as we can.
Dr. Barron?
Thank you. I would like to add to that. I had the opportunity to meet my class last week, and it was a good discussion, a lot of good questions and points, and a good environment. But one of the things that really caught my attention was the students who said that they like this because in this time they can keep track of their fellow students and know that they're okay. Mm-hmm. So there really was this sense of community. And you can imagine if this was all disconnected in individual homes or home offices, that someone could slip away. Someone could not see that connection. And that's why, without that sense of community, without that sense of engagement, we see lower completion rates. And so I just want to echo what Nick Jones has said, that sense of community as well as the delivery of the right educational outcomes is really very important.
And what is remarkable, I think, to the President's point, is that this emerges in small class environments, but also emerges in a different way in much larger classes as well. So I think it's a very important consideration for us.
Thank you. David Gray, we have a very technical question for you. What should staff units, or how should staff units document expenses with a possible eye towards possible reimbursement down the line through some sort of federal disaster relief? I'm assuming that there will be many different expenses incurred during this time not normally done.
Absolutely. So about 3 weeks ago, we sent out a communication to all of our financial officers. Each academic or business unit at the university has a financial officer assigned to help manage the budgets and the finances and the accounting for all of our disparate units. A message was sent out to those folks about 3 weeks ago that asked them, and this was at my request, to start immediately tracking all pandemic response related costs. Anything that was above and beyond the ordinary that was brought about or affected by our response to COVID-19, we asked our financial officers to begin tracking immediately. And that would include not only expenses incurred, but if you think about some of our auxiliary enterprises that are very much tubs on their own bottom financially, self-sustaining enterprises, it could also include revenue losses. And we've asked for all of those to be monitored and tracked as well as we move through this. It would certainly be our hope that at some point there may be federal stimulus measures. We know they're being debated and discussed in Washington, D.C. as we speak. There could be some state level responses, and we need to be ready to, as an institution, document all of the financial effects, both on the cost side as well as on the income side, so that if there's any eligibility for recovery of funds from either the federal or state government, we would be in a position to do so. At the very least, even if there aren't subsidies available from any levels of government, I think it's imperative and extremely important for us as leaders of the institution to know what those cost impacts or financial impacts are, for us to be able to share and disseminate that information with our board of trustees is exceedingly important. So for all of those reasons mentioned, we're tracking right now those impacts on our finances from the pandemic very closely.
Dr. Barron, I think you wanted to add something to that?
Yeah, I just wanted to amplify that. It is truly important, and it's not in some ways just we should do this just in case. We are watching in the stimulus bills a lot of opportunity, and our government affairs group are working very closely with the Pennsylvania delegation because there's flexibility for students to help ensure that we can continue to pay work-study students. There are opportunities to recover costs, to look at regulations that are associated with maintaining research operations whole. So as we start to strategically think about our budgets and the financial impacts, knowing that information can enable us to much more effectively manage the finances of the university. And if we don't know the answers to those expenditures, then surely we will not be able to recoup some of those expenditures and help us keep this ship on a steady course.
Thank you very much. And this last question came in. I do apologize if we did not get to your question. As I said in the beginning, we have had hundreds prior to this, and we've had a few more hundred come in just during this live event. We will do our best to follow up with some written answers to some of those that we have not got a chance to address today. But this last one was somewhat uplifting, so I thought I wanted to end on this. We had someone reach out to us, and if asked there was anything that people in the community could do, anything they could build. We've seen people making their own masks, any way they could give back to the community, to hospitals, anything along that nature.
There are actually so many things going on, and again, it is truly uplifting, whether it is the opportunities for the university to share a parking garage for mobile testing for, say, Mount Nittany, or the use of a residence hall or a hotel that can be used for isolation of patients if things get bad. We have individuals that are looking at 3D printing opportunities in the university to develop prototypes, which then local manufacturers may be able to use to go into production that will help the folks at Hershey. We have individuals that are working to first identify all the personal protective equipment that we have on our campuses and collect that if needed so that we can deploy it to a particular place that is in dire need for those supplies. And we also have a student assistance fund, which as of this morning, more than $100,000 in new donations from over 1,200 different donors, and we're just beginning there, that can help people in need. We've also seen a tremendous need in food banks to be helpful, and Penn State has taken a lot of perishable goods and made sure we're distributing that to the community. So you asked a specific question, but really the answer is very, very broad in terms of how we can all do more to help people manage this pandemic.
If I could add just one thing, I know that many of you who are watching from home, and I think Penn Staters have a very strong reputation for taking care of their Penn State community. This is a different time. I think it's very important that Penn Staters also seize the opportunity to take care of their broader community. Check in on your neighbors. Check in on the older couple who live down the street, virtually, of course, or by maintaining appropriate social distance. But we want people seeing Penn Staters throughout the Commonwealth really stepping up and being leaders in the community. That's certainly what I think we're all trying to do through institutionally, and we would just love to see our Penn Staters be perceived as really rocks in their respective communities.
Well, I'm going to make one group of friends and one group of enemies at the moment. People at home, we actually have another half hour. I apologize for worrying people that they weren't going to get some more questions answered. To all of our people answering questions, I apologize. You're on the hook for another half hour.
And no worries.
We did have a question come in about visiting scholars. Provost Jones, we'll direct this to you. Many people have asked us, can this continue? Do we need to stop this process? How should we address this?
We have about, I think the number, if I'm remembering correctly, is about 300 visiting scholars currently at Penn State, and we are working very closely with that community to ensure first that they're taken care of, because many of them are obviously away from their homes or away from their home countries in some instances, but also to ensure that they too can continue to contribute to whether it was the research or the teaching enterprise in ways that their colleagues with whom they are visiting are doing. Obviously, they are subjected to many of the same restrictions and constraints as all of our Penn State faculty, staff, and students. But we are paying very close attention to their needs and supporting them in the unique ways that they need support. Out of an abundance of caution, we do think it's prudent to probably pause at this point in inviting new visiting scholars to campus. In the short term, we have the practical challenge and reality of them simply not being able to get here. But even over the medium term, we think that this is going to be, from a processing standpoint, an additional load that many of you who are focused on so many other important things to support the core mission of the university simply won't have time to get to in the near term. So we are going to pause the invitation processes for new visiting scholars until we get a little bit more clarity. These visitors are an important and vibrant part of our scholarly community, and we just love having them here, but we also realize the practical realities and the need for folks to be focused.
You know, and there is a flip side to this. Much as we bring scholars in, our faculty members are asked to go other places. So how are we treating faculty travel at this point, both internationally and domestically?
Yes, so the university has issued fairly specific guidelines about limiting travel. I forget the exact date that we have out there right now, but I think it is at least through the end of this semester. We would urge caution for faculty in making any plans for future travel because we just don't know when that is going to be possible. But certainly, if you do need to make such a plan, we would urge everyone to have a plan B in addition to plan A, just in case original plans are not able to be fulfilled.
I think regarding this town hall, we had plans A, B, C, and maybe throughout the rest of the alphabet because we really wanted to make sure that we were able to answer your questions as they were coming in. And we hope that you are bearing with us. Again, we are realizing things are being done differently through technology today. But I wanted to take this moment to remind you there are some other options. If you're having trouble with the stream, it is embedded on the news story from this morning. There are a lot of people watching this, but we are streaming in 2 locations, and we are also simulcasting on a radio station that was laid out in the news story this morning. Following up now, I'd like to ask a question to Lorraine Goff. We had a faculty member reach in and who was on a hiring committee and said that they have scheduled interviews and are more than willing to do them via Zoom, FaceTime, anything of that nature, but should they continue to do those, and do you have any recommendations?
This is really a challenging issue because we know we have critical positions we need to get filled, but we also are concerned about honoring social distancing. And the reality is when we're moving through a search process, at some point, individuals need to come on campus. And so, again, I think a discussion with the unit leadership about whether or not to move that search forward would be important. There are certainly ways to do it, and there will certainly be a need to do it in some areas, but there really isn't a blanket response. I think it'll be on a case-by-case basis. So I encourage anyone on the search committee or anyone looking at filling positions to work with a unit leadership who can then escalate it and have a conversation with senior leadership about how best to move that search forward.
Thank you. Dr. Barron, we had someone write in. We're looking for some clarification on your announcement at the beginning to your commitment to paying employees through the end of April. Does that affect paid work staff, hourly employees, and will that affect the number of hours those employees are paid?
So it is for every employee, and of course for an hourly employee who may have not a regular schedule, we will have to examine how it is that we will do that. But our intent is student employees, the full set of employees at Penn State University.
Thank you for that clarification. Provost Jones, we had a direct question come in for you. What advice can you give to faculty members who are working with a different group of our students? I'm referring to the graduate students. How can they best advise them in this time where a lot of the things that they need to be doing are more hands-on in nature? Yes,
differently would be the short answer. I actually have personal experience with this. Earlier in my career, I transitioned from one institution to another, and some of my own graduate students stayed behind. It wasn't in response to a crisis. It was a professional opportunity. And we had to figure out, I had to figure out with my graduate students how to bring the same degree of interactivity and rigor in a remote environment. It was different, for sure. And it was very interesting what emerged. We adapted. And actually, I would say in some ways we actually became more disciplined in the way those interactions played out. So there are some upsides and some benefits here. I realize that it's particularly challenging if there are hands-on components to the graduate students' research. But as I indicated earlier, we have provisioned, subjected to Senior VP Weiss's guidelines, the ability for people to come in and do that, at least the critical research that needs to be conducted in a laboratory. The ability to continue to do that may become more restricted moving forward, and we would just be looking for faculty to work with their individual students to think about ways that perhaps other components of the research can be addressed now that don't require that physical interaction, and that can be deferred perhaps till a little bit later in the year when some of the restrictions are eased.
Thank you. David Gray, we have a question for you. And we have a couple of our campuses that were under different restrictions than the rest of us. I'm thinking of Abington, Brandywine, and Great Valley, who were, we don't use the word closed, but they were closed a couple of weeks ago. And is there any thought to bring them more in alignment with the rest of the university?
Yes, so obviously the campuses in the greater Philadelphia region, and you just named them, Ben, are under tighter restrictions from Governor Wolf than other parts of Pennsylvania. But we are looking at ways in which we can bring as much alignment as possible to the treatment of all of our campuses, both University Park and all of our Commonwealth campuses. And I would actually want to accentuate the fact that that by and large, given the aggressive promotion of telecommuting, remote work, that there are probably more similarities across the university's different locations than there are differences at this time. And we all should potentially be prepared for the restrictions to become more developed or more evolved as time goes on. It's conceivable that that those restrictions could be applied more broadly. So it's important for us, and we are working toward, I think, some pretty reasonable degree of alignment across the different physical locations of Penn State.
Thank you. Lorraine, you mentioned earlier about the university pharmacy was still going to be open. If you could explain what the situation currently is with the rest of university health services.
So University Health Services is not part of Human Resources. However, it's my understanding that that is also open at the moment.
Yes.
Provost Jones, you can add into that.
UHS is primarily oriented at serving the needs of our students, and based on the reports we're getting, they are quite busy with the students that they are tending. We would encourage faculty and staff to use their providers and clinics, and of course, because many people are working remotely, that may be a more natural alternative anyway.
And is there any message you'd like to give to this community and the rest of our employees that are struggling to continue to work during this challenging time?
Yes, that is a hard one. But I go back to something that we talked about before, which is the innovation and creativity that exists in every corner, every nook and cranny of this institution among our faculty and staff. Things have changed. Things are different. Think about new ways that you can engage with the university. Don't think about the things that necessarily you have always done or the ways that you have always done them, but think about different ways that you might be able to help the university, and send an email to your supervisor and say, I had an idea that perhaps I could help by doing this or by doing that, something that ordinarily wouldn't cross your transom. As we've transitioned to a whole new mode of operation, some of the day-to-day things that we used to do, we are certainly no longer doing. But there's a whole lot of other things that we are doing that 2 weeks ago we couldn't have even imagined would be on our radar screen. We need help with that, and we need Penn Staters to be leaning in there and thinking creatively about how to engage around those tasks and making suggestions and looking for those opportunities.
Thank you. Matt Ferrari, we have another question coming in from the audience for you. Given your background as a scientist, do you have any projection on how long we're going to be in these social distancing practices? You know, one can imagine summer is right around the corner. Most people want to get out and go to baseball games, have picnics. How long are these encouraging best practices going to remain?
Yeah, wow. So I'm surprised it took this long to get to that question. So what you're asking for is a projection of how long this is going to last. And you know, the disclaimer has to come with this, that almost any projection is going to be wrong in some specific way, right? But I do think we need to be prepared for this outbreak to take longer than we might otherwise expect. I think one of the things we can do is we can look to the experience of the rest of the world and see how long things had to be put in place there. If we take, for example, the Wuhan, China, and Hubei province, where this outbreak began, it took 12 weeks from the start of the outbreak for them to complete the outbreak and get down to 0 cases again. Now that's 12 weeks is actually relatively encouraging because across the whole of China, they were really only severely affected by this outbreak in that one province. 85% of cases occurred in that one region of the country. In the US right now, we have cases in all 50 states. So we're actually dealing with a more broadly distributed outbreak. So I think that suggests that we really need to be prepared for a longer term of disruption than we've seen elsewhere in the world. We need to prepare for that eventuality. We can hope for something better, and we should absolutely work right now to put in place the systems and the structures that are going to help us have that faster resolution. But we absolutely need to be preparing now, hopefully, for the situations that we won't have to take on down the road. So I think everybody should be prepared for a longer term disruption in terms of our ability to interact with each other as a community and maintaining this physical distance, right? Again, what that's doing is buying ourselves time to put in place the health system structures and develop the best medical practices that are going to allow us to more efficiently direct our resources towards the ill than putting restrictions on the healthy right now.
Thank you. I was surprised how long it took us to get that too, but I guess people were more concerned with the immediate questions that we were getting and not looking as far ahead to the future. But thank you. As we do continue to look ahead to the future, we've had some people ask questions about summer sessions. Have we made any decisions as a university on how summer sessions will be affected? Nick Jones?
Sure. I would say that we're following the advice that I gave in response to another question earlier, and that is we have a plan A, and that is to proceed with summer sessions as originally envisioned. But there is a very strong plan B associated with that. In all likelihood, our ability to really have an unimpacted summer is severely in question at this point. And so I think the plan Bs, which are continuation of remote experiences, are likely to be more the reality. But we're planning for both, hoping for the best, planning for the worst, and that's the mode that we really encourage everybody to be in. And taking all of those things that we're learning now as we transition to this remote environment, both for work and instruction, and applying all of that best thinking to what an alternate summer might look like. I'm very mindful of the warnings that Matt is providing, and so we're trying to be realistic about this.
And with that would come programs who, not so much students now, but perhaps future students, New Student Orientation, LEAP. Are there decisions also being made about these? Or do we need to, again, I believe you put it, to hope for the best and plan for the worst?
we're certainly plan Bing all of those. I think many of you may be aware, but I'll share this story just in case you are not, that we transitioned new student orientation almost on a dime from being obviously an on-campus, in-person experience to being a virtual one with huge effort and I think great success. So as we think about some of the things that are ahead of us for the summer, I think we're going to be bring the same innovation and creativity to transitioning some of those programs to their virtual equivalents.
We just had another question from Matt come in. And what is the likelihood if someone is infected once that they could be reinfected, or are you in the clear after that first infection?
Wow. I really wish I had the full answer to this at this point. The science on this is really evolving. The scientific community only has as much experience with this particular virus as the whole rest of the world. So we're really only days or at best weeks ahead of everybody else. There are some encouraging thoughts out there. So other coronaviruses, other similar viruses do tend to provide a period of protective immunity after infection. So to the extent that this virus behaves like other things we've seen before, we would expect a period of protection thereafter. There have been some research studies that have already been put in place in model organisms, particularly in rhesus macaques, that have shown that they do produce an antibody response that is consistent with what we see in humans. And so that was actually a really important scientific advance, so that now we have a demonstrated animal model with which we can study the progression of this disease and the development of the body's response to it. So we don't know right now. Again, we're proceeding with, we're proceeding in a spirit of cautious optimism that that long-term immunity and protection to this virus will be consistent with what we've seen in the past. But again, we're doing everything we can to gather that evidence and translate that evidence into medical recommendations going forward.
If you can explain more on that, since this is, people throw around the word unprecedented, but this is something that we haven't seen before, and how does that affect how scientists such as yourself study this and then provide those recommendations to people if it's truly something they've never seen before?
Well, I guess in some respect, scientists are really good at dealing with things we've never seen before. That's the whole nature of our work, right? So we've been practicing for that experience our whole scientific careers. It's just that it hasn't been so nearly impactful on ourselves and on our communities. So really what we're doing is we're trying to bring together those best practices, doing objective science, documentable science, that we can then learn new things and process that, evaluate our biases, really check to make sure that we understand the evidence that's coming in and process that, evaluate it among the scientific community before we put that out and make policy recommendations. So we're always balancing this tension between acting on prior experience, which is well demonstrated but is unlikely to be specific to this particular outbreak, and then adding in that new evidence over time as science builds up that new information. And slowly, we're shifting over to being able to make specific recommendations that are targeted at this particular virus and this particular scenario, right? And ultimately, that's the world we're trying to get to.
Thank you. Lorraine, we have another question for you. Someone wrote into us, and they're concerned that if they or another Penn Stater is infected with coronavirus and doesn't have the needed sick time to properly quarantine themselves, is there anything that can be done? Is there any thoughts of a bank of sick time?
Yeah, they should reach out to the HRSP. We certainly want to make sure that people are able to take time away to take care of themselves, and we do not want the lack of paid time off available to be a deterrent in any way. And so please reach out to the HRSP, and we will ensure that there's time made available they can take care of themselves and frankly take care of the community as well by not going into an environment where they could expose others.
Thank you. Nick Jones, Provost Jones, I know this is one of your favorite topics, but how is this going to affect the strategic plan? And we've had these the plans in place for so long, and now everything has been sort of upended.
Right. That's actually a great question, and I've been having conversations with many of our deans this week who've asked that very same question. My response generally is, and I think I'm really connecting with the comments that the President made a little bit earlier. It's always important to be strategic, even in normal times. But when we're in a time of extraordinary challenge like this, being strategic is even more important than ever. So thinking to the future, thinking about what is really most important to us as an institution as we navigate through these challenging times, with an eye on getting to where we need to be 1, 3, 5 years from now as we emerge from this. And emerge we will. We just need to be emerging in the right direction. Some of the specific questions are about process. Of course, we'll be more flexible in some of the timelines that we had laid out for the strategic planning process. But a crisis is a really important time to be very thoughtful and very strategic, and that's what we're trying to do as an institution.
Dr. Barron, I understand you wanted to add?
No, I want to echo that. It is extremely important that we are thoughtful and strategic. It's an interesting place to think about strategy. After all, human behavior in social distancing and hygiene is going to have a lot to do with the level of impact and the time period that we have to address. And the longer it goes, the more stressful that is. Topics like a stimulus package, ability to really hone a remote education and live our mission, all of these things are at the very core of what it is we do as an institution. And so to think through all of those different categories carefully, while at the same time watching the environment move and change in such a fluid way, is both a challenge, but I think it's one of the strengths of Penn State to be anticipating what the needs are and have it be based on what really is our core mission and objectives. So despite the fact that this won't be easy, having that strategic focus, I think, is what sets Penn State apart.
Thank you. Provost Jones, we have one more question for you, and it is a topic that has come up quite frequently in the student section, so I'm sure we'll be addressing it later. But this does affect our faculty members as well. Have there been any decisions made on the Faculty Senate recommendation regarding the satisfactory, unsatisfactory grading period?
Yes, we've had a group working on that has responded to the Senate resolution as well as the resolutions we received from a number of student organizations. Actually, this morning, during the time of this town hall, ACU, the Administrative Council on Undergraduate Education, was meeting to consider a draft proposal from that group. I'm sure it is being further shaped by the insights that ACU provide. But we hope to have a recommendation and a procedure out, actually, hopefully before even the end of the day. Once ACU has reviewed it, it will come back to me and the President for final sign-off, but we hope to get word out on that very soon, in fact.
Thank you very much. We are now again nearing the end for real this time. So I did want to ask Dr. Barron if you had a final message for our community. Is there anything you want to say to Penn Staters right now?
You know, I think it's really true that this is a we are moment. This is how we create community in the midst of a crisis, how we deliver on our mission despite the fact that that the ways that we normally deliver our mission have been interrupted. And again, I'm really, really heartened, and I think the entire administrative team is really heartened by the degree to which people are stepping up and being creative. When I hear from a student that was going to interview through career services, and the interviews are canceled, yet someone in career services is connecting that employer to the student so that they can do a Zoom interview, then I get this sense of just how powerful this community is. But at the same time, this isn't easy, and I know how much stress this is for everybody. I just want to end by reiterating how much we appreciate what the staff and faculty are doing for Penn State.
And I'd like to thank Dr. Eric Barron, Nick Jones, David Gray, Lorraine Goff, and Matt Ferrari for answering all of our questions today. As I said at the beginning, we have gotten several hundred, probably above 1,000 questions. So obviously we could not get to them all at once, but we will endeavor to provide answers online as a follow-up. I also want to thank the community for coming together during this unprecedented challenge facing us all. And again, if we all do our part to limit our social interaction, be vigilant with our personal hygiene, and quarantine yourself if you feel sick, we can help slow the spread of this novel coronavirus and flatten the curve. There will be another town hall today at 3 p.m., and it's going to focus on students and the questions that those students and their families have been asking. So please tune in for that as well. And I'd also like to remind you to bookmark and continue to visit the virus site that we've created. It is psu.edu/virusinfo. Again, it's linked on this liveevents.psu.edu site, but it is the most up-to-date information from the university's response regarding this novel coronavirus. But again, thank you all and have a good day.